Speaking at the best of American Society of Clinical Oncology, ASCO, Africa 2026 conference, the Director General of NICRAT, Professor Usman Malami, says government initiatives are making cancer care more affordable through the Catastrophic Health Fund, which subsidizes cancer prevention, diagnosis, and treatment for eligible patients. He adds that NICRAT National Cancer Health Fund supports indigent patients, while the presidential initiative for locking the healthcare value chain will boost local production of cancer medicines.
It's from global discovery to local delivery. Now it is a forum whereby the learning that were done during the ASCO annual meeting are actually going to be used or translated using the local strategies, this time around the African strategies in Africa. So how can we passion the epic research that were presented during the ASCO and then tailor them, localize them to the needs of Nigeria.
The immediate past president of the African Organization for Research and Training in Cancer, ARCTIC, Dr. Miriam Mutebi, and ARCTIC vice president for North America, Dr. Abiola Ibrahim, say Africa accounts for only about 8% of global cancer research despite its heavy disease burden. They urge government to invest 1% of GDP in research and development to strengthen cancer care.
We were doing research that was actually aligning with other global priorities, meaning that if we looked at the research that we were doing versus the cancer burden we're seeing, which we know in Africa is breast, cervical cancer, colorectal, prostate, we actually noticed that cancers like cervical cancer and prostate cancer were actually not having practically very little research. One of the goal of this conference or this initiative is to start thinking about how do we assess it as a pan-African initiative, or to bring in the whole African countries together, economies together, because there's power in number. And the goal is that at some point, if we get to a point whereby all the countries are able to access therapies, we have to do that as a instead of a country on